Yeah, well, I'm kind of a little bit speechless, but I was thinking to the point and the comment of the earlier session where there's really lack of information or guidance for the postpartum mother about nutrition. And that's getting now at this idea of lactational programming. It's so complicated, right? So you have things happening pre-pregnancy, then things happening within pregnancy, and then not to discount what's happening postpartum that all influences the milk. Then when you look at the research, what the outcomes are in the babies, it's just like a real mixed bag. So I'm wondering, is the reason why we don't have good information for mothers in that early postpartum period because it's just so complicated and we haven't really been able to condense it properly yet? Like what would be the recommendation here around nutrition, either pre-pregnancy, during pregnancy, or postpartum for the considerations of breast milk composition?
Well, I think it depends on what you're trying to measure. I mean, I think that what I was trying to measure was just micronutrients, and then there are hormones in milk and so on and so forth. Actually, in our current study, we're trying to measure all that. I hope it works. This took massive funding by the Gates Foundation, and I don't see any institutions in the US that are undertaking that kind of interest in assessing nutrition status of the US population. Particularly, they're always underestimating the number of women that are needed to do in the lactation group. It always gets very short shrift, okay? There are always many more pregnant women than there are lactating women for a number of reasons. And so if you see studies, the number is very, very small in the lactation category. I think that in clinical practice, and I'm sure people might disagree with me here, but the mother, certainly in developing countries, the mother is the focus of attention until she delivers. And then the baby's the focus of attention, and the lactating mother is kind of ignored. There are no WHO recommendations about supplementation in lactation, for example. Multiple micronutrients, there's even discussion about whether they're still needed in pregnancy for how many people, but if they were taken in pregnancy, maybe some of that benefit would carry over into lactation, but that consideration is never included in the discussion about the need for multiple micronutrients. So I think it's a fault of inadequate investment into the situation. I think until we really define the functional deficits in infants, from growth to behavior to whatever else, there will be much less interest in this topic than there needs to be. So that's another challenge, is to link that in with the whole milk composition agenda.
Because we saw a lot of evidence this morning from cross-sectional, observational and prospective trials, and one of the takeaways for me as well from this session was the comment that randomized controlled trials are possibly unethical to do. And I'm wondering if that's the case, then how do we actually advance sort of the evidence that changing the maternal diet or changing different aspects of the maternal health is going to be beneficial to the breast milk or to the baby?
I'm not sure I'd agree that it's completely unethical to do a randomized clinical trial. Maybe, I mean, if we're talking about a vitamin, a vital, essential nutrient, maybe. But if we're talking about diet patterns, and I think that, one takeaway, I was, struck by this notion of, there's 1,000 things in milk, but you're going to pick out in one study one of them to look at, or 10 of them. And it's the aggregate in healthy foods, as was mentioned earlier, that we're trying to promote healthy food intake and diet and food patterns. And so I think that would be a way to go, is to set up trials that are really about what we know best about promoting healthy food intake and food patterns, and match that perhaps with information on weight gain or weight management during pregnancy to sort of suss out this issue of weight gain versus just healthy diets during pregnancy and lactation would be very, very helpful. I mean, I'm actually not an interventionist, but I'm not sure that we would say that that would be unethical at this point. I don't think that the knowledge is at an equilibrium point where we know what the result would be at all with regard to lactation as a behavior, GDM as an outcome, infant outcomes. So I would go forward with that notion.
So I would support that by saying, well, we have done or been involved in with maybe 20 or 30 randomized controlled trials in micronutrients. It's what the field does out there in developing countries. But the weak point is measuring the functional outcomes in the infants. Hardly anybody knows how to do that well.
Thank you for 3 great talks, but I particularly wanted to thank Lindsay for the wonderful compilation of data you presented and mention for vitamin B12. I think Bonnie Specker did do some observational studies with Reggie Shang in the 70s and in vegan, while they were macrobiotic mothers living in Boston. And I believe that Vaya van Staveren from Wageningen also studied that cohort and had some findings on B12 that were exactly the same as what you reported.
Yeah, absolutely. There's documented detrimental effects on the infants. We were actually involved in that long ago Specker study in Boston, and the methods for milk B12 were wrong there, and Daniel Lee and everybody in the Netherlands never measured milk. So I was making the point that we don't have the milk data.
Hi, I'm Amelia Foley. I work as a community nutritionist at Community of Hope in DC. My question is mostly about the last 2 talks. I find in a lot of times when we're talking about BMI studies, there's no control for weight stigma. And as we learn kind of about the negative and bidirectional impact that weight stigma and also weight cycling has on health, I think I'm curious, A, if that's something that was controlled for, and then B, I'm just interested to kind of hear like what the thoughts are around that, because I think there was a beautiful kind of statement made around maternal depression and how the psychological then can become a nutritional and then also a biological problem. And I think that weight stigma and weight cycling could be used as, especially when you look at stress. And then just kind of echo a statement from, I forgot, from before about trying to pivot away from weight and looking more at healthy diets. Because I think more and more we're recognizing I think particularly the psychological stressful impact that has for moms. So thanks.
Speak to one thing, and you know, when I teach public health nutrition students, we talk about this a lot. And I sort of feel 2 ways about this issue of weight bias. First of all, it's really wrong that in our clinical practice, we're focusing so much on weight every single visit that we're ignoring the positive, wonderful things that everybody's body can do, and to focus on that, and what we can do where we're at. And that's really important. On the other hand, as a body of scientists and practitioners who are surveying the population and seeing that it is important that women try, and we work with them to support them, moreover, to, let's say, retain a gestational weight gain within guidelines, because it's just known to be very important for the birth outcomes for their child, really important ones. So it's sort of holding both of those truths in mind at the same time. I guess I just sort of come at it with that sort of philosophical thing that both are true, that weight gain can be deleterious, but an individual woman in the context of her weight must be, you know, we have to acknowledge that stress is not good, and that's not good for her, it's not good for her baby, it may not be good for her milk. But to the point of how much that has been dealt with, I would say in the areas that I was surveying, it has not been. And I think it's a really important area to look at interactions of stress, because in fact, what we could be seeing as BMI effects may actually be largely explained by stress effects we don't know yet.
Well, I have some comments on it because my research showed, I mean, we know the diabetes literature says that levels are highly associated with developing diabetes. That's the physiological facts. But my research with lactation showed that lactation has some other physiological effects that have nothing to do with the weight change. They really seem to be independent. The major protective associations seem to be independent of it. And I think that's a really important contrast that I was trying to make in that last slide, was that, you know, we have a lot of postpartum lifestyle interventions for women with gestational diabetes that totally focus on weight in the postpartum period. And I strongly agree with you that we should not be focusing on weight loss, regardless of whatever the woman gained or whatever her BMI was before pregnancy. That's not the phase. Perhaps a year later, once this lactation and adjustment to maternal life. But if we're over-focused on weight in this postpartum period, I completely agree. It causes a lot of stress. What we should be focusing on, and this was how I like to think about implications of the research on pregnancy and lactation, is the if we would, and I talked to researchers all over the country at universities about this, is if we're going to look at what should we do during the postpartum period, prevent stress, prevent depression, address any depression, address sleep, help women get enough sleep because that's associated with depression. Help women have a fairly healthy diet as much as possible. And then the fourth thing that I like to talk about is policy about paid family leave, and that there are physiological demands of recovery from pregnancy and the need for lactation in terms of disease prevention of the leading causes of death in women, which are related to type 2 diabetes and heart disease. So, and don't talk about weight. Completely agree.
Great. So that actually kind of maybe takes over some of what I was going to ask, but I think leads into it well, which is, you know, this is so complicated, and it's not just the mother's health or the child's health and behavior that dictates infant nutrition, but it's the society at large. And so, you know, I wonder, I'm still stuck with feeling that breastfeeding is so terribly confounded by, you did an elegant job of looking at maternal physiology during pregnancy and even before pregnancy, but all the social factors that contribute to a woman's ability to initiate and continue to breastfeed, and how much the literature can really tell us about, you know, have there been studies in Scandinavia where there's more leave, or in developing countries where the confounding is a little bit different?
You know, that is an excellent question. And the literature for the Scandinavian countries is extremely difficult to deal with, and even China, because 98% are breastfeeding, and they have family leave, maternity leave policies so that they breastfeed for a year. Many of them. Some of the work that my colleagues in Denmark have done actually have found some really strong protective associations with less than 4 months of breastfeeding in terms of risk of cardiovascular disease. So I think, and combination of exclusive and mixed breastfeeding. So I think the societies may be changing there in terms of breastfeeding practices, and maybe we can learn more in that vein. I also believe that in the studies that we did with the SWIFT cohort, we did look really carefully at perinatal outcomes that are pretty strongly associated with whether a woman breastfeeds as well as breastfeeding intention, and it did not have huge effects on how women were able to reach the intensity. But I think there are social factors related to employment and support systems. And the SWIFT cohort and Cardia were completely consistent with the literature showing that African American women were 50% less likely to breastfeed than the white women and the Asian and Hispanic women. And that's actually well comprehensively reported in the literature. And what the factors are that determine that suboptimal breastfeeding, we have still this long road to explore. And also there was a report of just a few years ago saying that women with obesity are not receiving the same level of education and support for breastfeeding as other weight groups. So we have a lot of work to do to try to address these vulnerable populations and what the social factors are. I completely agree.
Do we have questions from our webcast?
I think I'm going to just take one question that's slightly different from what's been discussed. Ellen, this is for you. Interesting point on the discussion around maternal breast milk concentrations and offspring obesity. There might be a U-shaped relationship between maternal leptin and offspring obesity, such that below a certain maternal leptin level, leptin's protective. However, above a certain level, as in very high concentrations as seen in obese women, leptin may not be protective of offspring obesity. Also, wouldn't it be important to look at effect modification by BMI? Have there been studies addressing these issues?
My knowledge, those are good points. And so the density of data to show the U-shape, if you've noticed a lot of those slides that we see of the scatter plots of relationships of, let's say, breast milk anything to infant outcome anything, you can see the scatters, right? I mean, these are not very beautifully tight relationships. It's basically a blob of points and with some scatter out here. Okay, sorry, I'm gesturing. But so we aren't at that point with the number of subjects or maybe sort of the control factors in the designs or other things. So it could be U-shaped. That would make sense physiologically. A lot of things are. We don't have that data yet. And the second point, I think, was about modification by BMI. Most of the studies try to adjust for BMI to see if there's a residual influence of the factors on the infant. But effect modification certainly could be a point.
And then just one last question that came from the group has anybody started to differentiate the effects of lactation either on infant health or on the mom if the milk was pumped and just bottle fed to the baby versus the actual form of breastfeeding?
We actually have those data in my SWIFT study. We did ask how much of the breastfeeding was by breast and by bottle, breast milk in the bottle, but we haven't analyzed the data yet. So something for somebody to come and join my team to get at, because I'd love to know I've had that question asked before, and it'd be interesting to see if it does matter in terms of the health outcomes for both.
I would say that that's a good point, and it was mentioned that the Azad study did show that that's very important for microbiome outcomes, but it has been understudied, and it's very important because the ACA supported purchase of or insurance coverage for breast pumps, and so women are really, really doing it, and they're breast pumping a lot. Even those who want to be exclusively breastfeeding are often doing so in a mixed manner from an early point in lactation. So that sort of delivery mode is really important as far as the delivery of the milk.
Okay, well, I think with that, we'll need to conclude this session. I'd like to thank each of the session speakers for their remarks. Very interesting, very thought-provoking. And so at this time, we'll break for lunch. And for audience members attending in person, there's the cafeteria located in the basement level of this building. And we will reconvene promptly at 1 p.m.